Hi everyone, so my name is Dr. Teosi, and today we'll be covering an important topic around apps that will be useful for you as a medic. So whether you're a medical student or you're a doctor already in another country wanting to come to the UK to practice, or you're a new doctor, so as an F1 really, this would be fantastic for you to have on your phones. Times are changing, so you need to keep up with times. So today we'll be covering 15 apps that you can have on your phone, and that would give you access to quite a lot of information in terms of helping you with confidence, in terms of understanding what is happening on the wards, on the shop floor, or in GP land, regardless of where it is. And one of the apps is actually one that I designed, and that was me trying to find a solution to an existing problem. So yeah, look out for more information about what app that is really, and that will be mentioned later on. So I'm super excited to get started. If you are, let's get started. 15 medical apps for you to use as a medic. Number 1, BNF, so that's the British National Formulary. You definitely want to have this app or access to this app. So in terms of access, why I'm saying access is, so you've got the downloadable version as in an app that you can download, but for some of you that think, oh, you just want to use the book version, there are print versions available. So you just need to find out from your trust. You don't need to pay to get it. It should be available on one of your wards, or you can speak to your chief pharmacist as well. But because we're talking about apps, so it will be BNF app. Just to mention, we've got the children's version as well, and that is BNFC. So you want to look into downloading both of them. That would be your central guide when it comes to medications within the UK as well. Okay. The next app we're going to talk about is called the Induction app. And as the name suggests, it is an induction app really, and people find it really useful to have it on their phones, because what it does is it gives you contact numbers to different team members within that hospital. And actually you can even call from your phone directly, on that app. So it's a really good one to have, instead of constantly having to call switchboard. Please can you put me through to this person? Please can you put me through to that person? So Induction app is one you definitely want to get as well. And the good thing about it is it's applicable to you regardless of what hospital really. So just search for your hospital and then actually download, have access to the Induction app that is specific to your hospital. And if you need to change hospitals, because we all rotate most times, as junior doctors, then absolutely that is fine. So guess what? You upload your details and confirm you're at a different hospital, and you have access to that as well. Okay. The third one is called MicroGuide. Yes, MicroGuide. So with MicroGuide, it is simple. It is literally as it says, MicroGuide. So when you think about antibiotics, what antibiotics should you be prescribing? Now, what MicroGuide does is it gives you what your hospital specifically uses, because the interesting thing is a lot of these medications, particularly with antibiotics, you tend to find that different populations, even within the same country, different populations respond to it differently. So based on research, evidence-based medicine, different hospital teams have found what works best for their population. So in one hospital, for example, your first line of management could be Coamoxiclav, but then if you go down south, your first line of management could be something different really to Coamoxiclav. It could be amoxicillin in that case, but you need to make sure that you're doing the right thing specifically for your hospital. Don't just assume that, oh, I know we just use antibiotics for that, and you just prescribe what you prescribed in your other hospitals. Find out what is specific to that hospital. A MicroGuide is beautiful in the sense that it will give you the antibiotics that are specific to the particular hospital you're looking to work at. So that's a really useful one to have as well. Number 4, and I need to make it clear that all of this is in no particular order. Okay, so Pocket Doctors. Now, what this app does is it's a really good one. It gives you like a checklist. So if you need to assess, some common emergencies, some common conditions, if a patient is hypotensive, for example, what do you need to be looking for? So it gives you a checklist of what you need to quickly walk your way through. And it can be a really good one for you when you're in your early stages to get you understanding concept, how things work, for example. So that's a good one to have as well. So that is Pocket Doctors. Number 5 will be MD Calc. Now, in medicine, we all know there are different calculations. Now, there are different apps out there that would help you with calculations, but the ones I've gone for are particularly the ones that have been pretty much common, in my within my circle, really. So it all depends on what user interface you like. For example, it depends on how easy it is to access that. One of it, has a paid element to it. Depends, are you willing to pay to access all that is available on it? But anyway, so the next one is MD Calc. And this is an app, that helps with any medical calculation. Now, off the top of my head, I'm thinking of the DVT Well score and what that means to you. So in terms of calculating that, really, it's like, making sure you're plugging in the right things to get the right value. There's also, for example, CHA2DS2-VASc score as well. Now, that is CHA2DS2-VASc score. So that is also something that will need calculating. There's a Hasbled score. If you don't know any of the things I'm talking about and you're a medic, as a medical student, feel free to go and read about it, really. So they are key components, and MD Calc is one that would help you when it comes to doing the calculations for that. So you've got MD Calc. And then we've got number 6, MedCalcs. So again, another online calculator. This one divides things into categories for you. And then when it does that, what happens is you can then pick what category you want to sort of venture into. Now, the only issue is some of it is a paid version, so you actually have to pay to gain access to it. But it's also another calculator you can have on your app as well. Number 7 will be the iResus. iResus, resuscitation is key within our practice. So it gives you basic components, what you need to be working through if you're on calls, for example, and you need to be thinking about BLS, ALS. It gives you a nice walkthrough as to what you need to be doing at every step of the way, really, step by step. And it's quite colorful, so I quite like that about it, really. So that is your iResus. Then you've got your BMJ best practice, and this will be number 8. BMJ best practice. So again, this is for you to keep up to date. BMJ stands for the British Medical Journal. So this will help you keep up to date with that, and you can actually be well-rounded, because a lot of people think about, if I'm working so hard on the wards as a doctor, where would I get the time to actually update my knowledge? And BMJ best practice is a good one that will help with that. Then you've got Notability. So as a medical student or as a trainee or a doctor at whatever stage you are in, you're expected to continuously keep learning. So that means you'll be attending teaching sessions, you'll be gaining knowledge from different webinars, you'll be gaining knowledge from different resources. So you might want to document all of this, really, at Notability. And Notability is a good app that can help with that, really, where you can keep your notes that you've created, and actually you can categorize them, keep them in different folders as well. So that is a good one for you to have as well. And the next one at number 10 will be the Emergencies Handbook. Now, this gives a summarized, concise sort of version, really, of what you need to be thinking about during emergencies. This is a good one to have. Again, it will help you to build your confidence in terms of practicing on a day-to-day basis. Our next one comes in at Talkspace, the Talkspace app. Now, this one is important. So with Talkspace app, so if you have patients that are coming with an overdose of some sort, what you can do with the Talkspace app is then see and calculate. So if they've had X number of medications as an overdose, what is the effect? what is the plan, what is the management plan as recommended by Talkspace, and it'll walk you through what you need to be doing at every step of the way. So Talkspace app is an important one in terms of being able to manage toxins, toxic substances, any overdoses as well, poisoning in general, really. Yeah. And up next is number 12, Geeky Medics. Oh, this one I think is particularly good for procedures, because if you want to quickly go through a procedure before you actually do it, it's not saying you don't know what to do. Sometimes you just need that little bit of refresher. Instead of being able to get on YouTube and then not have great signals, if you have the app downloaded already, the Geeky Medics app, then you can have access to this information. For example, catheterization, doing ABGs. You can just have a quick read, go through it step by step, what you need to do. And then you go and just do what you need to do. So yeah, Geeky Medics can be quite useful as well. Okay. Then number 13 is touch surgery. Hold on a second. In case you don't want to be a surgeon, that is fine. You don't have to be a surgeon for you to be able to use this app. So this app is beautiful because it gives you an idea of, what different procedures actually mean. So if, for example, you have a patient that comes to you saying they're about to do a procedure and, for example, appendectomy, and you're not sure what happens there, you can watch this to help you build your knowledge base as to what on earth that procedure actually means. And it's quite visual, and I quite like that about it. So that is touch surgery. All right. That is touch surgery. At number 14, we've got the Foundation Doctor Handbook. Now, this is really good. I think it goes into quite a lot of detail when it comes to different assessment, how you document. So in terms of how you're documenting practically, it would walk you through step by step. So if you're not using a software at work that already gives you all of that prompt, this is fantastic with that. And even if you're on calls, this will actually help you to know what it is you should be thinking about, so you can gather evidence about it and then document it as well. And finally, number 15. Thanks for staying through to this point. It's actually not finally, it's the last, but it's so not the least. And finally, this app that I designed. And like I said, I'm happy to do a video separately around quality improvement and what we can do to help, help the system get better, but also for us to get the most out of the system. So for this one, I designed it out of, the pain of trying to understand the various medical abbreviations available. And then I realized that I wasn't the only one in this boat. Quite a lot of people were in this boat. And, any IMG really, most IMGs, especially in the first few months, everyone's like, ooh. So you need to be willing to take in a lot to learn, be like a sponge to learn, because every healthcare system is different. Abbreviations are a key thing, and we don't realize how much we actually throw around, and we expect people to just know. So off the back of that, I'm pleased to announce that I have now launched the UK Medical Abbreviations app. It's available on Google Store, it's available on the Apple Store, so you can always get it. There's just one fixed price for it, and for the first year, all of it is going towards our impact project in terms of helping people around the world. So I'm super excited to launch that, really. And you know what? If you find any abbreviations that you can't find in there and you think should be there, just send us a message, let us know about it. Download it. It's a one-off price to download. There's a guest version as well, so you want to utilize that as well. It's a one-off fee to be paid, and it's less than a cup of coffee or hot chocolate for one day. It is less than that. So make sure you download it, tell people about it, and like I said, in the first year, all the funds raised from that will be going to help our impact project, where we believe in helping people all over the world. And details of that, you can always see that in the links, really, in terms of our various impact projects. So I hope you found that useful. I've gone through 15 different apps that you can use in your day-to-day practice. And we're talking about apps, that medical apps that can be used for medics. All right, if you have any questions, any thoughts, any ideas, any other apps that should be added that you'd highly recommend, definitely let us know about it. All right then, take care. Bye-bye.